What is your name?
Jack Singer,
Where are you from?
uh, West Bloomfield, Michigan.
What type of community service have you participated in?
Um, I participated in working at a clinic for the uninsured from the ages of 19 to 64.
What role do you think volunteer work plays in building a community?
I think we have to take care of the less fortunate, and I do think that healthcare is it's a necessity, and it's a right that every human being should have access to, and so therefore I feel good about being able to help those who are less fortunate and don't have insurance or an ability to pay.
How did you find your way to this organization or volunteer work?
When I retired, I wanted to continue to do something in that area, and I was actually contacted by my temple, and they said that this would be something that they thought that I would be interested in doing, and so that's where I've been for the last 10 years.
Can you explain the purpose of this organization or volunteer work?
The purpose of the organization is to provide health care, which includes physician visits as well as drugs and medicines to the uninsured from the ages of 19 to 64. And the reason for those ages is because if they're under 19, they can get insurance under the CHIP program, which is a federal government federal program for children. And if they're over 64, starting at 65, they can get Medicare. So that's the reason.
What do you like most about this volunteer work?
It gives me an opportunity to feel needed. I feel a sense of accomplishment when I can help others, and they are very appreciative, these people, and they often will say to me, "Thank you for what you're doing, and we really appreciate it. It's a great thing that you do," etc. There's a lot of positive feedback to it.
Who do you think directly or indirectly is helped by the volunteer work that you do?
Well, the people that we provide the health care to are directly affected, directly benefit by what we do, because we're serving a community that would not have any access to health care. So these people, we take care of their diabetes and hypertension and heart disease and cholesterol monitoring and other problems as they exist.
Tell me about the pieces of your volunteer work that leave you most satisfied.
Well, I think that the whole experience is very satisfying when I go there, and I've dealt with people who wouldn't have access to any care without what we do there. And I'm not the only doctor that works there. There are others, and also we have other volunteers there. There's a dental clinic, and so there's dentists that work in there. We also have nurses who give some of their time. There are other volunteers, and there's some specialists that come in. I do general medicine, and there's others, like they will have a neurologist there once a week or once a month, and they have a podiatrist comes in and takes care of foot problems. So there's a lot of others that I'm not the only one, but we do provide a pretty wide range of services to people who otherwise would not have care, are getting good medical care and free prescriptions. By the way, we have many generic drugs, and we give them out to these people on an ongoing basis.
Uh, can you share with me what makes this community service worthwhile for you?
Uh, Basically, I think I sort of answered that question because, as I say, we're providing care for those who need it, and um, and again, it's people who would not have access to even medicines, basic medication for high blood pressure, for heart disease, for cholesterol problems, for other problems. We take care of people with rheumatoid arthritis, and we also try to get drugs from the drug company for free for people who need more drugs than we can provide in that clinic.
Do you think do you think people have a responsibility to volunteer in some way within their communities? Explain.
Well, I think that if we're blessed with having a special expertise that we can provide, and we have the time and you know and the vehicle to do it, I think it's a great thing for the community, because really all of us are responsible in some way for everybody else. We don't live in a vacuum, so it's important that we take care of our neighbors and friends and relatives and wherever we can, and also the less fortunate too. So.
Okay.